Let's look at some of the research in a normal, healthy population, and then we'll look at what we see in MG. Isokinetic testing was 5 bouts of 30 leg extensions with a 1-minute rest, and they found that reduction in the decline of the peak torque production during the later bouts 2, 3, and 4. Paul Greenhoff has done a lot of research with creatine. 1 repetition maximum bench press, where they're able to do total reps at 70%, increase the 1 repetition maximum, and at reps at both 70%. Running 4 by 300 meters with 4-minute rest periods and 4 by 1,000 meters with 3-minute rest periods. Improve the time for the final 300 and 1,000 meter runs in total times. Yes?
Is this after 1 dose? Is after a long period?
No, yeah, what it is, it's after several doses. Some of these have been dosed. This is the main thing as far as what they're using, the training group and the control group, and that they've given them several days. So it's after a loading period. Yeah. Cycling 10 6-second bouts with a 1-minute rest. They're better able to maintain their pedal frequency during 4 to 6 seconds of each bout. Some of the adverse effects, muscle cramping, GI, stomach upset, dehydration. And again, in MG, it could be even more pronounced, and this is due to the osmotic shift that creatine pulls water out of the soft tissue and into the cells. The NCAA did a study, a 5-year study, showed no adverse effects on healthy kidneys over 5 years. Some renal failure has been reported, and endurance performance may be affected by the weight gain. So really, it's utilized in high-intensity repeated bouts of exercise. Okay, let's move into neuromuscular disease. Mark Tarnopolsky, he's in Ontario, has done quite a bit of research with creatine, and he's got this one study that looked at it. And I have to reiterate, there's a paucity of studies. There is not a lot out there on MG and exercise. So what I have here is it, except the last slide on respiratory training. But Mark looked at creatine monohydrate. He looked at 10 grams a day for 5 days, and then did that with 81 patients. And then he took a second study, open trial study, 5 grams a day for 5 days, 21 patients. He followed them, and he looked at body weight, hand grip, dorsiflexion, which lifts your foot up, knee extension strength were measured before and after treatment. He found that creatine increased all of the indices, increased total mass on the first study, 70.4 to 70.9 kilograms, and 74.5 to 75.2 kilograms. No effect from placebo. It was well tolerated. The problem is there was no patients with MG. Most of them were. One patient had McArdle's disease, which is another neuromuscular disease, and they had some cramping. Drawbacks to the study, it was a very small sample size. The neuromuscular disease was not differentiated, so there could be a statistical error due to the study. It's a very short-term study. No long-term effects were actually done that would potentially help out the patient population. So most supplement studies, if you read, are very short studies. We tried to do a creatine study back at Cleveland Clinic, and one of the things was trying to get a washout on some of the subjects, because a lot of them don't want to go off of everything that they're on just to be on the creatine. So a lot of them, if you read the literature, a lot of them aren't usually 6 to 8 week type studies. But there was one. There was a case study, resistance training and creatine supplementation in MG. So a 15-week case study determined the effects of resistance training and creatine on body comp, training volume, peak strength, and blood work in a generalized patient with MG. He's a 26-year-old male. He was on prednisone and azathioprine. He was on creatine. It was 5 grams a day, resistance training, and exercise 3 times a week. They looked at blood work, body weight, fat-free mass, and measured before and after training and after supplementation. They looked at leg extension, leg flexion, and volume load, which is the amount of repetitions times the mass or the weight. They found was after creatine supplementation, the body weight increased 6.8%, fat-free mass 4.3%. If you look at upper body volume load, so doing a lot of chest exercises, 37%, and go down to even leg extension, 37%. The blood chemistries remain normal. So it did improve in all indices. And you can see on the slide, the dumbbell bench press, his change increased almost 40.7%. Now, this has been replicated in a number of studies, prednisone versus neuromuscular function. So it really makes it interesting and pronounced at how patients with MG will have even more of an uphill climb when they're on prednisone. Drawbacks of this single case study is that in previous studies, from the 40 to 100 milligrams of prednisone, they experienced decrease in strength. So this was the silver lining but again, it was only one case study. From the 15 weeks, our patient was on 60 milligrams. And it is suspected that the creatine may have attenuated and decreased that decline. So I think it may have had a beneficial effect. It would have been nice to see, maybe to do a follow-up study and see off the prednisone, although I think his MG would have probably had an exacerbation. Now, we said it was a single subject study. Regarding its treatment, prednisone is usually the standard of care, although it probably lessens the immune response, as we said. And patients who, with MG, have a single dose of prednisone, 40 to 100 milligrams, acute inhibition of the neuromuscular function was observed.